let's talk safety for a second. Getting massage during a pandemic can be stressful for both the therapist and the client. So we've spent hours making sure we're putting in a plan to address just that. For a therapist, their PPE is going to consist of several things. For one, they're all getting their own personal face shield that's reusable, and we have as many of these surgical masks as they need that they're going to be switching out after every massage. You're also going to see them in aprons. It has been recommended that therapists either change their clothes or wear some type of apron during massages. So we have a linen service that's going to be delivering aprons so they can have a fresh apron after every one. Other things to think about, health screening. So the therapists are going to be, the entire team will have a health screening every time they come in. We'll take their temperature, and then they're going to answer 3 questions. Do they have any of the symptoms? Have they been out of state in the past 2 weeks? And have they been exposed to anybody they know of that's had COVID? If any of those are yes, we're going to send them home and discuss the follow-up on that. The clients, you are also going to have a health screening. We're going to take your temperature when you come in. If you have a temperature, we're going to ask you to leave and do what you need to do to make sure you're okay, and then get back in touch with us when you're feeling fine or your temperature is down. We do understand that it's allergy season, so we've been telling the therapist that too. If you have a cough or you have something that's allergies, please make sure you're letting us know in the best documented way. But if you're running a fever at all, that is the biggest red flag for us in combination with allergy. So for you, you're going to have the same thing. You're going to have a health screening. We come in, we're going to take your temperature. If your temperature is good, you'll have a piece of paper that you will fill out every massage. So again, this is going to be every time you come in. This is going to be the series of steps during the pandemic. You're going to be asked questions about whether or not you're a healthcare worker. And if you are, if you've worked on a COVID floor or had COVID patients in the past 2 weeks, if you've been out of state, if you have any of the symptoms, if you've been around anybody that you know has been COVID positive. We're using that 2-week window of safety. If you answer yes to any of these questions, again, we're going to ask you to just leave the studio and then get back to us when you can reschedule. If you answer no, we're going to have you fill out a liability waiver that just says that you understand we're doing everything we can to take precaution and that you are also doing everything you can in sharing information with us accurately. And then basically contact plan tracing agreement. If for any reason, once you're in, if you are tested positive in the next 2 weeks, that you will call us within 24 hours and let us know, and that we will be calling clients that were in 24 hours on either side of you to share that information with them without sharing any personal information of yours. So that is the plan for the safety screening. Once you're in your massage room, every therapist is actually assigned 2 massage rooms. They're assigned one that they're going to start their day with, and then after the first massage, they're going to transition to the next one and then back and forth. This allows us a couple of things. They're going to have 30 minutes between their sessions, and that allows them to clean the rooms. We have touch points that everything's going to get wiped down or sprayed with Clorox and make sure it's getting reset. We also have vinyl mattress coverings, and so the sheets are going to go on top of that. After massage, we're going to wipe that down. We have vinyl pillowcase coverings, so we can wipe down the pillows and then still put a pillowcase over it and switch that out. And then we have UV filters in each room that will recirculate the air 4 times per hour. The best part, I think, though, is we're assigning the therapist 2 rooms, so actually it's going to be an hour and a half between people being in a room, and that's just going to allow us the most time for the air filtration in those rooms. That's the primary bit of our safety pieces that we're putting in. We're also, same thing, the restrooms are getting touched. Anytime there's a change of shifts or people have been in, we've got the points in the restroom that we're wiping down, handles, toilet seats, sink handles. So just making sure we're over abundance of caution, focusing on that. We are talking about the front desk whole job right now is going to be safety and service. Just making sure you feel safe and you have service. And the therapist, same thing, safety and service. I think one of the things I do want to share, though, is every therapist is going to have a different level of risk tolerance and things they're willing to do. As a company, we are not doing any intraoral TMJ work. We have made that decision. But some therapists may feel more comfortable doing neck work or jaw work. So we are giving them the discretion to make those decisions and share that with you. We are also letting them know if at any point during massage they feel they want to end the session because a client is coughing or they just don't feel safe, that they also have the right to do that. So we're putting all the power of the authority of whether or not a massage actually happens inside the hands of our therapists. And we ask that our clients understand that we're working inside of a pandemic and they're going to make the decisions they feel are in the best interest of the safety of themselves and the safety of you and our community. And I think that's really what I want to stress. Our safety measures here are meant to make sure the team feels safe so the community feels safe. And the only way we can all do that is if we're honest with each other, if we're taking good care of each other, we're sharing the information we need to share, and we're just making good decisions. So we invite you to be a part of that. We think massage can be safe, very safe during a pandemic, but we also know we're in the early stages of a pandemic and that we need to be willing to adapt as we go. And so the therapists also have been given that opportunity to let us know what they feel safe doing. So things may adjust as we move through this. We ask that you continue to just have patience with us, share requests that you have, ask good questions if you want so that we can answer anything, and just help us make sure we're doing the best things for the right reasons. So this is our little safety review. Any questions or concerns, josieann3@gmail.com, 734-474-4206. We are having Chris bring in 10 clients this week, the week of June 22nd, so we can put these in place and get actual live feedback. What are the clients saying about wearing a face mask? What's the best thing we can do? The therapists are coming in next week to practice and to do training, and we're asking them to start a best practices document so that together, as we're learning from clients or we're learning from each other, we can make adjustments that we can share with the team so that so massage still feels very relaxing, is very therapeutic, and of course is super safe. Thanks so much. I look forward to hearing your questions, and we'll see you in soon.